A tight labor market with few open jobs, rising prices for housing and everyday necessities. And between it all, you have to think about your health care coverage. For millions of Americans, their current plan is a bleak reality as premiums skyrocket, leaving many to contemplate whether or not to leave their coverage behind. Ahead of the House's vote to extend expired Affordable Care Act subsidies Thursday, I spoke to an economist about what that means for the broader picture of health care in the country. Those Affordable Care Act tax credits were keeping 22 million Americans afloat in our health care pool. Now, some are looking at as much as a 114% increase in premiums. The risk? 4 million Americans are left uninsured.
What does that look like to have a populace that might be largely uninsured?
If you're hurt, you have something, you're going to let it go, slide for a bit. But at some point, if it becomes serious, you are going to go to the hospital. At that point, hospitals will take care of you, but it's going to become expensive and they're not going to get compensated for it. So that's the biggest problem. Another problem is that people who are uninsured, when they still get help, that puts an impact on the rest of us who do have health insurance, because what makes health insurance premiums lower or cheaper is when you have a broader pool of people who are in coverage. Now, if people who aren't covered are using it, then that's going to raise the premiums for all of us.
Therein lies part of the problem. And for families who have someone who's actually sick or has a debilitating illness, not having coverage isn't an option.
So what's going to happen is that they have a decision to make. Do you stay on health insurance, pay more, so for some people it's 50% more per month? It's going to be really difficult. And so you make the decision, okay, well, we still need to have health coverage because we have people who are sick. Then the question is, where does that money, that increased premium, where does that money come from?
Decisions also have to be made by Congress. Utah's Celeste Malloy when we asked her about Thursday's vote.
Healthcare is a separate issue that we are dealing with. We have a lot of good ideas in the House. We're ready to tee them up and vote on them. We've got to come up with something that can also pass the Senate.
In what would be considered some good news, you have until January 15th to re-enroll in the marketplace if you're not satisfied with your plan as it stands. Remember, there are local insurance agents who can help you navigate options that might be best for you and save you some of the expense. Local agents will be better equipped to handle your Utah insurance questions than a national hotline number. In the studio, Robin Ogenye, Fox 13 News, Utah.